COVID-19 doesn't just cause respiratory illness. A study released in August 2021 showed that patients hospitalized with COVID-19 have a greater risk of stroke than those with other types of infections like the flu. We sat down with Dr. Simi Park, Vascular Interventional Neurologist, and the Stroke Medical Director at Community Medical Centers. She explains what happens to the brain when a stroke occurs and how having COVID-19 puts more people at risk of having one.
Usually after COVID infection, patient experience the upper respiratory symptom first, and 2 to 3 days after, the storm of immunologic inflammation can occur after enough amount of virus inside the body. Then the patient could have stroke symptoms suddenly. There is no way we can predict who is going to have stroke symptom in early phase of COVID. However, when we are aware of the stroke symptom, we can actually act fast to prevent disability because of stroke. Most importantly, someone who has a high stroke risk, such as old age, obesity, smoker, high blood pressure, diabetes, cholesterol, high cholesterol, and arterial fibrillation, congestive heart failure, those kind of condition can have more stroke occurrence among COVID patient. If it's someone who has those kind of high risk stroke risk factors, they can be more careful to monitor symptom. There is a word, be fast. So balance problem, I is vision difficulties, and fast, F is droopy face or asymmetry, A is arm weakness, and S is speech difficulty. T is time. So when those kind of symptom occurs, time is very important. We need to act fast to call 911 and come to emergency room. And when patients arrive in the emergency room, we can offer reperfusion therapy, which is restoring blood flow, removing the clot. It can be done by medication if the patient arrive in the ER within 4.5 hours, or within 24 hours, we surgically remove the clot to open up the vessel again, and then we restore blood flow and restore brain function.